Every year, 760,000 children die to diarrhea-induced dehydration. Dehydration is easily treated with IV therapy, but in developing nations, clinicians are hesitant to administer this life-saving treatment due to the fear of overhydrating the child, which can lead to edema, high blood pressure, and death. IV regulation technologies used in developed nations, such as infusion pumps and disposable syringes, are inadequate for use in these low-resource clinics, which are in need of a more durable and sustainable method of volume regulation. Over the past 2 years, our team has validated this need by conducting countless interviews with Malawian and Basotho physicians. In response to this problem, our team has created IV Drip, an entirely mechanical IV volume regulator that will allow clinicians in developing countries to safely and confidently administer IV therapy. Its simple mechanical design is modeled after a physician scale. To set the dispensation volume, the clinician would place the counterweight on the notch that sets the device in equilibrium. At equilibrium, this lever arm will be parallel to the ground. And then, the clinician would move the counterweight 1 notch for each 50 milliliters of fluid she wishes to dispense. For instance, if you wanted to dispense 300 milliliters of fluid, you would move the counterweight inward 6 notches. Next, the clinician needs to slide these 2 knobs together, like so. Finally, the clinician would push the tubing into the 2 tubing holders. At this point, she's free to walk away to treat other patients, because once the set volume has been dispensed from the IV bag, the 2 lever arms will re-equilibrate, causing this tubing to kink. The kink that is formed will stop the flow of fluid and thus prevent overhydration in the patient. As you can see, the kink is similar to that of a garden hose, and it stops the flow of fluid entirely without damaging the tubing. This ensures that the fluid in the tube remains sterile so that the bags can be used again, and this, in turn, saves both resources and funds. Several advantages of this device include its entirely mechanical interface, which eliminates the need for electricity. This makes the device not only simpler, but also more adaptable for regions in which electricity is not reliable. Its use only requires 4 steps, so it is easy to learn and operate. Additionally, the device is very flexible in that it can dispense any amount of fluid from any starting volume. IV Drip is a robust, adaptable device that can significantly reduce the risk of overhydration in children of the developing world. It gives clinicians the ability to reliably administer dehydration therapy to those in need and has the potential to save hundreds of thousands of lives each year.